thank you so much for taking the time to share in this 20th anniversary Giving Hearts celebration. There's an aphorism that says, "A rising tide lifts all boats." Through your collaborative efforts, economic policies, community engagement, and family contributions, you've been that rising tide that has allowed Heart of Ohio to better serve the healthcare needs of our community. So once again, I say welcome. Thank you again for coming, and I hope you enjoy the rest of the evening.
Patricia, thanks very much. Hello, everyone. My name is Scott Light, and it is a pleasure to serve as your MC tonight. I'll try to guide us through this journey, and I love that one kind of action word that we have tonight, because boy, this has been a journey for Heart of Ohio, and we've got a lot to celebrate tonight and a lot to look forward to as well, because the future is very, very bright. I want to share a little bit before we get to dinner, just a little bit about, I want you to know you get a little bit more than just an MC here. In that I come to you tonight to say that I am a full-throated partner with you, with your mission, with everything that all of you do, and especially with Heart of Ohio. And I can say that in this respect. From 1992 to 2020, I was a 28-year broadcast journalist. And I had the good fortune to work in 6 state capitals, including here in Columbus, and was able to tell stories actually from 4 different continents. A lot of those stories involved healthcare, involved wellness. And unfortunately, a lot of those stories involved people who couldn't get it. Involved the social determinants of health. Involved people who just didn't have access to getting good, holistic, quality care. So I've been there, and I've told those stories. And again, I've worked for companies that wanted to tell those stories and put them out there to the masses. A 20th anniversary celebration. So there, as a journalist, at least I like to think that I did my homework whenever I headed into a story or a big interview with a newsmaker out there. So a 20th anniversary, there are several things that you can get if you're getting a gift. They say for a 20th wedding anniversary, maybe you should give a gift of china. The gemstone is an emerald for a 20th anniversary, but largely people circle around the word platinum when it comes to a 20th anniversary, right? So when it comes to platinum, it is malleable. It is, in the chemical world, it is often described as a noble metal. And it is, like I said, it's malleable, it's ductile. It is something that can be formed in many different ways, but it never loses its strength. It is always strong. Platinum also has a high melting point. So think about a couple of those properties that I just mentioned. Something that evolves, something that can change, something that has high melting point. That could take on several different definitions there. And something that is noble. Think about those properties and how they relate to the Heart of Ohio Family Health mission and the people at Heart of Ohio. All those folks exhibit all of those qualities and so much more. This is a gentleman who has been strengthening healthcare for decades in his own noble way, too, as you're about to hear. He is a product of Columbus and Whitehall communities. He has enhanced women's healthcare, again, for decades. not only in Columbus, but also in the Charlotte, North Carolina area. When we talk about leaving a legacy, we're talking about a physician here and a medical expert who's done everything from establish patents in the medical world to delivering more than 8,000 babies. Yeah, that's a legacy, right? He and his accomplished wife, also speaking of legacies, 3 children, all 3 are also physicians.
I do want to begin by thanking the board of Heart of Ohio for really what I consider a tremendous honor. As we celebrate 20 years for the Heart of Ohio, whose mission, as you know, is to provide health care, particularly for those in need. It not only is admirable that they're able to do that on such a sustainable level, but they've done it for 20 years, and I think that deserves a round of applause. No doubt the work can be challenging, but oh God, is it rewarding. I will say that there's no greater reward than working with and feeling that you provided a service, particularly in an industry where someone is at need. It has been a beacon of light, as Scott said, a trusted space, and for many, their medical home. The Heart of Ohio provides care in culturally appropriately, linguistically appropriate, and equitable health care, meeting people at their needs.
Health centers put more shots in arms during COVID. They save lives. They do this work every single day. I've been going to the same doctor since I got here in 2015. And I've told my wife this, I'd love to almost go to him, and I love him, he's great. But I'd almost like to go to him one day and just say, hey, Mark, yeah, you just wrote me a prescription. Can I just go to the pharmacy down the hall? Or can I just go to the, I've got a toothache, can I just, where's the dentist office? Is it just down the hall? Or, you know, can you direct me to a behavioral health specialist? Because I'm sure you have those here too, right? If I were to say any of those things, he would look at me with a, like, did you eat 3 edibles before you came here? I mean, he would look at me really strangely. But as this group knows, community health centers are usually one-stop shops. And they have dietitians, and they have pharmacies, and they have behavioral health specialists, and they have dentists, and they have sports medicine, and they have ways to get transportation. They maybe have an Uber coupon, or they have a food pantry partner right there in-house. So I love that one-stop shop aspect as well, and that's another part of the entire healthcare system that just absolutely has to change. Let's talk about some special dedications, because we have some elected officials in the House tonight that certainly should be recognized. If I can, let me ask all of our elected officials to please stand. Let's give them a round of applause, please.
It is the 20th anniversary of Heart of Ohio Family Heath, a nonprofit healthcare provider committed to providing high quality and compassionate care to all people in the Whitehall community and throughout Central Ohio. And whereas Whitehall, Heart of Ohio's newest facility in Whitehall, Ohio, expands their ability to reach out even more to people, especially people in need. And whereas the city of Whitehall is forever grateful for the care and love that the Heart of Ohio has provided, to my community over the past 20 years. Now, therefore, I, Kim Maggard, Mayor of Whitehall, Ohio, do hereby proclaim June 22nd, 2023 as Heart of Ohio Day in the city of Whitehall for their excellent service and compassion to the Whitehall community.
Certainly, I invited my colleagues to come up from the legislature, Representative Mohammed, Representative Bettina Humphrey. I wanted them to stand with me and all of the work that they're doing, because we're going through this budget period right now. We have a lot of conversation about what it is to do and serve people, particularly with regard to health care. And these are real issues. They're not hyperbole. They're not esoteric experiences. But I wanted to honor you tonight by being here and saying to you, your work has value. It saves lives every day. And so God bless you and that work.
I'm very honored to represent you all at the 3rd District here in the state of Ohio that covers the northeast side of Columbus. So I'm very honored to have the Capitol Park Family Medical Center in my district. And my mom at 75 years old has been a patient there. And I have extended family, cousins, and other family who have called that facility home for a long time.
I gotta tell you, I am super excited to be here with you all today to celebrate 20 years of service to our community, uplifting them, providing them with the services that they need truly means so much.
To have the privilege to introduce David. David and his entire family have given a lot to the community of Columbus. His mother was very passionate about gardening, and David decided with his wife Sydney, of blessed memory, to dedicate the gardens at Heart of Ohio to his parents and my father, Jim Feibel. So,
we want to honor you with this plaque for the wellness garden that you contribute in making at the James B. Feibel Health Center at Whitehall. Thank you.
The opportunity for me to provide something to really benefit Heart of Ohio. And I saw it in person today. I saw the access to health care. I saw it right in front of me. And I saw the excitement of all your staff, the commitment that they have to providing that health care. It was just completely overwhelming to me. So I'm just thrilled to be here, and thank you so much for recognizing me and my family.
We're going to continue on the award streak since we started. Before my speech, I want to recognize some of our staff who have done great activities. So what you see happening over there are a lot of staff behind the scene working to get this done. So let me start with the quality team. And none of them know this is happening. I do this every year. It's a surprise. To honor this team here for their activity in the staff engagement to make everybody at Heart of Ohio very engaging so that they can do their work. I just want to honor you for the work that you've done. Thank you. You have to have talented, engaged employee to do what you're doing every day. And there is one gatekeeper who does this every single time. You know, hiring a mission-driven people, bringing them in the environment, putting it in the standard. Her name is Jacqueline H. Woodard. I'm going to start with a story. The story that Scott is mentioning and the story that everybody is talking about so that we understand where we came from. That will give us a perspective where we are going. So the story that I'll start with is the story of the movement of the Community Health Center. So as we gather here to celebrate the 20th anniversary, I would like to start by telling our story. Our Community Health Center movement story, a part of Heart of Ohio Family Health story. This is 58 years ago. In America and growing strongly, how did we begin? How did we come here? In 1942, this is in South Africa, where two doctors, Sidney and Emily Kirk, K-A-R-K, Kirk, the Kirk family, these are a couple. They opened a health center in Palele, a poor region of South Africa, to deal with every aspect of causes of illness in this community. The clinic started providing vaccinations, gave regular medical checkups, and taught farming and cooking method to improve patient diet and health outcomes. This is a clinic doing non-clinical thing. What we call it today is sound like addressing social determinant of health. This is in 1942, right? So Drs. Kirk and the wife, did this holistic approach, and it became known as community-based healthcare. The Kirks were able to teach their method of community-based healthcare to medical students at the University of Natal, the first medical school in South Africa to train non-white medical students. 6 years later, in 1948, the government of South Africa introduced apartheid, a legal system of racial segregation. University of Natal students frequently clashed with authorities who were determined to separate races and stop what the Kirks were doing. And in 1957, the South African Minister of Education, Art and Science tried to take over the department where the Kirks taught their concept. Sidney and Emily Kirk eventually have to resign and move back to Israel. But not after a young student doctor from America called Jake Geiger was able to study from them in South Africa. In an effort to fight poverty in America as part of President Lyndon Johnson's War on Poverty, Dr. Geiger brought this concept of learning from the crux to form a community-based healthcare and apply a grant to the federal government to fight poverty using healthcare. That's how we began. Social mobility using healthcare to fight poverty. Dr. Geiger received a grant award, and in 1965, he opened 2 centers, one in Boston, Massachusetts, and the other one in Mississippi Delta region. And fast forward today, there are more than 18,000 community health centers across America and in more than 10,000 cities, and 29 million people were served. 1 in 12 people across America receive healthcare system in the community health center movement. We employ more than 200 people, generating more than $45 billion of activity in the US. Compared to non-community health center patients, our model of care provides greater quality care services and saves a lot of dollars. The calculation is that 24% of Medicaid savings per patient per year. Heart of Ohio Family Health started in 2003 by a dedicated and committed leaders such as Sister Barbara, Jim Fible, and many more, including my predecessor, Martin Miller, and Joy Parker. Our inaugural physician who saw the first patient in summer of 2003 is here with us, Dr. Sue Lederman. Can you stand and be recognized? Thank you for your service and thank you for what you've done. Dr. Sue Lederman saw the first patient and she's still with us 20 years later, providing care. Thank you. Thank you. Today, we have 6 locations. Heart of Ohio at Capitol Park, Heart of Ohio at James B. Fible, Heart of Ohio at Canal Winchester, Heart of Ohio at Whitehall Yearling School, and Heart of Ohio at Mount Carmel East Hospital, and Heart of Ohio at St. Anne's Hospital. In 2022, we saw closer to 16,000 individual unduplicated patients, generating over 71,000 visits. We are 172 mission-driven staff strong with 12 dedicated board members. Thank you, board members. Staff members, can you stand and be recognized, please? All Heart of Ohio staff members, please. You are here. Thank you. Thank you for what you do. Yeah. As you may also know, we are a leader in maternal care at Heart of Ohio among the Central Ohio FQHC. We couldn't have done this without the leadership of Dr. Dalia Alkari. Can you stand and be recognized? Thank you. Thank you. All other FQHC, if they want to send a patient, complex pregnant patient, Dr. Alkari say yes. So we have become a really leader in maternal care, and thank you very much for your service. What are the exciting things happening now at Heart of Ohio? 1, Heart of Ohio is recognized as Health Center Quality Leader 2 years in a row by HRSA. HRSA is our government entity. And this is a recognition that is only enjoyed by Heart of Ohio as of now in the Franklin County up to today. Thank you, staff, for all that you've done. We opened a new in-house pharmacy at James B. Fible Center to meet the medication need of our patient and utilize 340B program so every patient can afford his or her medication. And there is one person who is still here, Alexander Zaleski, can you stand up please? Who made our pharmacy really good. Thank you, thank you. And I'm excited to announce to you today that dental clinic is open in our James B. Fibo location. We saw our first patient. Hooray! And the person that made it happen is Dr. Chan. Dr. Chan, can you stand up and recognize me? Thank you. That's our director of dental. Thank you, thank you. So right now, we have completed our task as a Fibo center. We started with primary care, OBGYN, women's health, behavioral health, substance use disorder, like Scott was telling you, all under one roof. Pharmacy, dispense pharmacy, clinical pharmacies, and now dental. Thank you very much for all your support to get us to this level. We are going to continue advancing health equity. We will continue focusing on making a difference in the health outcome of the people we serve at OHIO Family Health. We measure on a monthly basis health disparity ratio. This is a new measurement we look at for our patients to implement decision support that will help improve outcomes. We advocate and practice cultural humility in our practices. The school-based health center is also another great opportunity and achievement that we have. And Superintendent Wells is here. Be recognized, please, if you can stand up, please. Superintendent Wells is the second superintendent I'm working with at the school base. You know, we started it with Superintendent Bryan, and then Superintendent Wells came, and her idea, we took it to implement. Now we are really meeting the need of what we set to do at the school-based health center. So we opened the school-based health center, like Mayor Maga said, in 2020, in the midst of the pandemic. Matter of fact, the first day that the governor said we're shutting down the whole state. Yes, we said, what did we just do? We opened a clinic and the school is closed. Right. So we said, because the concept here was to have a health center that is open to the community as well as the student. So we have a different entrance and exit. Even though the school was closed, we were able to open. We stayed open for 2 weeks just to test to see whether people would come up. It was nil. Then we decided to think about what is our next steps. And right away, there was a COVID testing system that came in place. We decided to turn that place to a drive-through testing environment. The governor wanted the testing. We say yes. School-based health center became a testing center. That is how the school-based health center advertised itself in the community. Because people drive there, get tested, say, oh, you have a clinic here. A year later, instead of struggling, what did we do? We have more than one physician, 2.1 FTE practitioners working in that school, seeing both students and also people from the community. Then, blessed to have Superintendent Wells, we started having conversation with her to talk and see how we can enhance. We instituted a deferment of expulsion by doing counseling. And then we also have something we call a preceptorship program that the superintendent and the team allow us to do, to have students come and do a preceptorship in the area they're interested in, be it nursing or administration or front desk or whatever, for 40 hours with compensation. And I believe we have some of the students that come to our system here. If you can stand up, be recognized, please, with the coordinator, Spring Lawson. Spring, please. these are the future healthcare professionals that to expose them into the environment, it might inspire somebody to go to a particular profession. Thank you very much for what you've done. Continuing the journey, what is in our future? We're going to continue our collaborative work. So we will continue to focus on improving access. Access in Central Ohio, like everybody has talked about, is critical for moving forward. We are also always going to ensure that all our services are affordable. We will not compromise on our quality. We're going to provide quality care, and it's going to be recognized, and we're going to measure it, and we're going to make sure that our patients feel that. We are also positioning our organization for future artificial intelligence and any technological changing in the healthcare. And we will continue to advance health equity. I would like to end my speech this evening by quoting one of the greatest modern American presidents. In the last speech to the nation, reading a letter from a supporter who wrote him, and I quote, "America represents something universal in human spirit," he said. I received a letter not long ago from a man who said this: "You can go to Japan to live, but you cannot be a Japanese. You can go to France to live and not be a Frenchman. You can go and live in Germany and in Turkey, now called Turkey, and you wouldn't become a German or a Turk." But then he added, "Anyone from any corner of the world can come to America to live and become an American."
What we've all said tonight, and that is, you've got this great story. You just do. And listen, I'm a former journalist. We're a cynical bunch. We are. We also have a pretty good BS detector. And I've mentioned before, you have best-in-class healthcare. You have best-in-class humanity. You have best-in-class people. And you do have a best-in-class story. Keep telling it.
I just want to thank all of you for coming, and let's go for another 20 years. Thank you.